Good afternoon to Dr. Gita. I'm Sneha and my matrix number is 202385, and today I will be presenting about how gene therapy can be actually utilized to treat obesity. So my presentation will include the introduction, problem statement, and also literature review. As for introduction, according to the World Population Review in 2019, Malaysia has the highest prevalence of obesity among adults as compared to other Southeast Asian countries. Based on the National Health and Morbidity Survey that was conducted in 2019, stated that about 19.7% of Malaysian adults and 14.8% of Malaysian children are classified as being obese. Obesity can be defined as an abnormal or excessive accumulation of fat deposits or adipose tissue in the body that can cause several health complications, including chronic diseases due to the enlargement of adipose tissue to store excess energy, resulting from increase of adipocyte number and size. Obesity is usually caused by environmental factors, but also genetic factors in some cases. BMI, also known as the body mass index, is the proportion of weight over the square of height and is used to categorize individuals into categories of underweight, normal, overweight, and obese. So, in general, obesity leads to many chronic health complications that include joint and muscular problems, respiratory disorders, cardiovascular complications, and also type 2 diabetes mellitus. Um, Based on a study conducted, it showed that an extreme obese individual is at a high risk of suicide also than a normal person in a general population. So this shows that obesity does not also causes a mental health problem. So as for problem statement, the main problem in treating obese individual is to provide treatment or medicine without any harmful side effects. Obese individuals who want to lose a large amount of weight faster and easily tend to consume slimming products or also synthetic anti-obesity drugs that are available widely in the market today. This type of supplements can be very deadly to the consumers because of the components in it that can cause a bad effect after a period of time. The synthetic drugs can even cause death to failure of organs after consumption. Examples of anti-obesity drugs with adverse side effects include orlistat that can cause serious gastrointestinal problems such as diarrhea, fecal spotting, oily stools, and also abdominal pain. Orlistat can also cause rare cases of acute kidney failures. I- That drug is actually a reversible gastrointestinal lipase inhibitor. Another anti-obesity drug is zonisamide that can cause also gastrointestinal problem, fatigue, and also insomnia. Phentamine, which is an appetite suppressant, can increase blood pressure, palpitation, and cause constipation too. The sudden rise of all these synthetic weight loss supplements is due to the increase of obesity every year. Hence, a more efficient and safer way should be used to treat obesity, which is by gene therapy. So before moving on, literature will cover on adipogenesis, what is gene therapy, types of gene therapy, techniques of gene therapy, and how gene therapy can be used to treat obesity. So before moving on, I would like to explain a brief explanation on what is adipogenesis. Um, Lipid, as we all know, is a wide group of macronutrients that has an important role in storing energy, regulating hormones, transporting fat-soluble nutrients, and also cushioning vital organs. Moving on, the main component of adipose tissues are the adipocytes. Adipocytes has an important function in controlling energy balance. Adipose tissue is a type of connective tissue formed from the differentiation of mesenchymal stem cells into adipocytes during castration of fetal development. The process of fibroblasts like pre-adipocytes are developed, proliferated, and differentiated into mature adipocyte is known as adipogenesis. Adipocytes not only play a role in nutrient homeostasis and regulating fat mass, but is also important in blood pressure control, immune response, bone mass, hemostasis, thyroid, and also reproductive function. This is because the adipocyte coordinates this process through the synthesis and release of peptide hormones. The process of fibroblasts like pre-adipocytes are developed into mature adipocyte is known as adipogenesis. There are two types of adipose tissue, which is brown adipose tissue and white adipose tissue. In brown adipose tissue, they release energy as heat, while white adipose tissue, they store excess energy as triglyceride. Okay, so moving on to the next slide. So, what is actually gene therapy? The transfer of engineered genetic material or nucleic acid into a human cell, usually by viral transduction, is to treat disease, repair mutated or abnormal gene, synthesis beneficial proteins to treat genetic disease, or restore functional normal protein synthesis is known as human gene therapy. In some cases, the disease-causing genes can be inactivated or replaced by gene therapy. The first gene therapy procedure was done by W. French Anderson and his colleagues on a 4-year-old girl who was born with severe immunodeficiency, or also known as SCID. Gene therapy has been great advancement in the research of genetics. Gene therapy is also applied for cancer treatment, wound healing, genetic vaccination, and also immunomodulation. So, types of gene therapy. So, basically, there are two types of gene therapy that includes firstly the germline gene therapy (GGT) and also the somatic cell gene therapy (SCGT). In GGT, the introduction of the functional genes into the genomes can cause the germ cells to be modified. This is heritable as it can be passed on to the offspring. There isn't actually much application or any application of GGT on human beings due to the lack of knowledge and research in terms of possible risks, ethical issues, and technical reasons. Next, SCGT is when a functional gene is introduced in any cell except the germ cell or the undifferentiated stem cell. It is accepted standard for basic research of the application of gene therapy to treat wound healing, for cancer treatment, immunization, gene-related disorders, and also other diseases. Acidity is not heritable and cannot be passed to the next generation, as the modifications and effects are only restricted to that specific patient only. So, technique of gene therapy. How gene therapy is actually the basic techniques of it. So, the target of gene therapy can be either a cell, tissue, or maybe even the whole individual. The introduction of the correct gene into a non-specific domain of the genome that replaces a non-functional gene is the most common method of gene therapy. A few fundamental compounds that are necessary for gene therapy are a sick gene, therapeutic gene, and an effective delivery mechanism or carrier called a vector. The vector could be either a genetically engineered virus, the viral vector, or naked DNA or DNA complex, the non-viral vector. Both of these can be used either from in vivo and ex vivo techniques in order to insert their gene into the host cell chromosomes without infecting the cells or causing disease. The viral vectors are modified in such a way, replacing the defective gene via homologous recombination and selective reverse mutation to fix the deficiency and produce normal mRNA is one of the novel approaches in gene therapy. Gene restoration, gene augmentation, and gene inhibition are the three different techniques of gene correction. Gene restoration is done when there's a small point mutation by the DNA or RNA chimeric molecule. Another common technique of gene therapy is gene augmentation, which is applicable to treat a condition where the functional gene is inhibited to produce a functional protein due to mutation. For instance, a gene augmentation can treat a type of anemia, which is known as erythropoietin responsive anemia. Next, the overproduction of some proteins can be prevented by gene inhibition. The two methods for gene inhibition of gene therapy is uh, in vivo and ex vivo techniques. The right gene is directly delivered into the target cell or tissue using in vivo techniques. The difficulty with this in vivo gene therapy is assuring the specificity and precisely targeting the target cell. Direct insertion of genetic material is possible through bioplastic insertion electroporation, gene gun, topical application to healthy and wounded surface, and injection into a particular tissue. The in vivo gene therapy technique is used when it's not possible for isolation, in vitro culture of the cell, and reinsertion of genetically manipulated cells. Ex vivo technique involves isolating the patient's defective cells, doing in vitro cell culture, and then infecting the grown cells with a genetically modified vector to introduce the correct gene. The cells that have been genetically altered are found, amplified in vitro, and then inserted into the whole cell. Since the correct gene is introduced into the right target cell using this method, there is a reduced risk of an immune response and a higher level of transduction. Nevertheless, it is specific for those cells that are only able to be removed from the body. Next, moving on, is how this gene therapy can be actually used to treat obesity. Recently, there has been a study conducted on obese mice that specifically reduces the adipose tissue and is able to reverse obesity-related metabolic disease like diabetes mellitus 2. This study was mainly conducted to overcome the bad side effects of synthetic anti-obesity drugs. In that study, a specific gene silencing therapy against a fatty acid metabolism gene FABP4 was developed. The FABP4 gene, or known as the fatty acid binding protein 4, is important in the regulation of glucose and lipid metabolism that relates to the metabolic and inflammatory process in target cells, specifically the adipocytes and macrophages. The elevation of FAB4 causes diabetes mellitus, hypertension, and even obesity. Next, a tissue-specific fusion peptide was used to target white adipocytes with a catalytically dead Cas9 protein and single guide RNA using a CRISPR interference method. The CRISPR interference method is an RNA-based technique used to specifically silence transcription in prokaryotic or eukaryotic cells. After internalization, the complex lowers FABP4 expression and decreases lipid accumulation in adipocytes. The complex is then internalized with minimal toxicity to the cells. Hence, when this study was conducted, was considered that it performed well in cells. Another study was done on obese mice following the same technique. Firstly, the mice were fed with high-fat diet so that they will be obese and insulin resistant. After just 6 weeks of treatment, FABP4 suppression reduced body weight by 20% and improved inflammation and insulin resistance. Additional systematic improvements were seen, such as a decline in liver fatty lipid accumulation and a drop in blood triglyceride levels. Moving on, as for conclusion, after a year of treatment in humans, the current standard of Food and Drug Administration (FDA) approved only showed a 5% of body weight loss. Although this therapy has shown promising outcomes in mice, more research is needed to be done before it can be used for clinical treatment for human obesity problems. In short, the advances in a precise gene editing technology can also be translated for other types of therapies for various purposes and to treat other diseases. So this is my reference, and thank you.